Dr. Ruchika Verma, postdoctoral fellow in Department of Psychology, University of Allahabad. I am going to present a module on the ASHA workers, NRHM struggle in Bihar, which has been written by Ms. Shashi Yadav, President Bihar Pradesh ASHA Karyakarta Sangh, and this is module 28 of paper 15. First of all, the lecture will begin with the introduction and context of the ASHA workers. The ASHA workers working under National Rural Health Mission should be praised and rewarded for their seminal role in improving the social indicators related to rural women and children. ASHA workers needs a little bit of elaboration here, as ASHA workers are the women who were employed by government under the National Rural Health Mission scheme, and they were specifically directed to help women for prenatal and postnatal needs of women. They are not treated at par with other government employees, however, working in the health sector. The women working as accredited social health activists are more than 9 lakhs in the country. So there is a bigger number of women who are working for this particular field of National Rural Health Mission program. However, these women are not recognized. That is why the ASHA workers, this particular module specifically focused on the needs of the ASHA workers, how their condition can be improved. But their working conditions are dismal and they do not enjoy the status of regular government employees. Of late, the ASHA workers have begun organizing a big force and have also been participating in agitations in different states for improving the working conditions. They are the backbone of rural health care for women, because these ASHA workers were the people who were introduced by the government through the NRHM program at the time when there was no support for the women in the rural areas. There was a state when women, the deliveries of women took place in home, and there was so many maternal mortality rate was very high. Who are ASHA workers? First of all, there is a need to understand what is the meaning of an ASHA worker. The NRHM program was established in April 2005 to provide health care services to those regions in India which were the most backward with respect to health care services, and it was started in 18 different states. The ASHA are the local women trained to act as health educators and promoters in their communities, and normally women address these workers by ASHA Didi. The Ministry of Health and Family Welfare, Government of India, describe them as health activists in the community who create awareness and identify various social determinants which mobilize and are responsible, accountable for the health services, for what kind of health services are required for women. And these ASHA workers, they make women aware of all the kind of facilities provided by government. ASHA are also meant to serve as a key communication between the healthcare system and rural population. Since rural women is uneducated, illiterate, unaware, and is not at all aware of the policies and programs in their localities, these ASHA workers help them to make them understand that these are the facilities which are available to them free of cost. So, the work of ASHA workers include motivating women to give birth in hospitals, reducing their anxiety that hospital is a good place to deliver a child, because most of the women in rural area, they are hesitant in going to hospital for delivering a child. Then bringing children to immunization clinic and encouraging family planning methods, treating any injury or giving them first aid for any kind of mishappening in the case of pre or post delivery situation, and maintaining sanitage and looking after other needs of women. So ASHA workers are in totality, they are trying to understand the reproductive and other health needs of women so that they can have a better situation, because women in rural areas are suffering and getting lot of infections and problems in their reproductive health. ASHA workers are voluntary workers. It is very important to understand that when the concept of ASHA worker was introduced in the society through NRHM program, these were the voluntary workers who came willfully to this particular field. The ASHA workers are only given performance based incentive. Their reward which is given by the government is only performance based. They are getting an honorarium of only rupees 800 to rupees 3000 in different states of India. So, depending on the state, they are getting an honorarium ranging from rupees 800 to rupees 3000. And for example, an agricultural laborer in Haryana may earn rupees 400 per month, whereas an ASHA worker in some other state may earn maybe 4 times. So, the situation of ASHA worker is different in different states. Now, for example, the states where there is lot of problems in women reproductive health, for example, the prominent states being Haryana, Uttar Pradesh and Bihar. These are the states where the condition of the ASHA worker is, the need of the ASHA worker is much more, however, the conditions of the ASHA worker is worse. The things become more prominent when the corruption is there. The CBI inquiry, the Central Bureau of Investigation inquired into the NRHM scam in Uttar Pradesh after the Allahabad High Court intervened. It came to be known that the funds which had been allocated for these health workers under the Safe Motherhood program or Janani Suraksha Yojana had actually been reached them or not. So, there was always, whenever the policies or government introduced some major amount of funding for the health of these women, the corruption took its toll and the money was not reached to the people who need it, and it was always gobbled by people who are in between the people who gave money and the people who receive money. There are a lot of in between who simply remove these facilities from the people who need it. That is why Janani Suraksha Yojana was not successful to that extent as it was expected by government. Now, what was the implications of the scam? Because whenever there is a scam, there are more and more negative implications of such kind of scams. While the ASHA worker were struggling for the status of permanent government employees in the last fiscal year, the government drastically slashed the allocation already made to Union Health Ministry by 10%, which comes to around rupees 2500 crores. So, gradually because of these scams, the center reduced the allocation instead of increasing it. The result was that the agenda of expansion of NRHM was badly hit, because of which further recruitment of ASHA workers was stopped and already existing ASHA workers were in a pitiable condition, because one scam in any of the states has had an implication on rest of the ASHA workers, and the condition of the ASHA workers became more deteriorating and gradually reduces the motivation of these ASHA workers to work for the benefit of rural women. The next task of ASHA worker. Now, the major things why these ASHA workers are relevant in the context of rural women health are: first is epidemic control. They work on a holistic level also, not only in addressing the reproductive health needs of women, they were also addressing the epidemic control. Then family planning, immunization, administration of ORS, that is pulse polio drops, then working on the other kind of disasters. So, National Rural Health Mission was, although they introduced ASHA workers, and these ASHA workers were working on a very broad scope, however, their conditions needs attention. Now, what was the scene in Bihar? Since this particular module is focused on the National Rural Health Mission ASHA worker program in Bihar, so now we will discuss about purely the condition in Bihar. In a survey conducted in Bihar among 2 lakh rural households, it was found that only 8.39% of people, they had some kind of toilets in their homes. A large number of families did not have access to pure drinking water. So, some of the main NRHM scenario in Bihar was the issues on which they focused were, first was the availability of toilets, second was the availability of the drinking water. There were potholes all over where dirty water was accumulated and caused spread of diseases. Third was defecation in the open places, excessive use of asbestos for construction along with contamination due to use of pesticides and insecticides. And last, AIDS was spreading in northeast Bihar as more and more male members of the family were migrating as laborers to Bombay, Gujarat and other metropolitan cities and coming back to their homes during the agriculture period, during the time when their crops has to be sown and cut down, and then at that time they used to carry infection from the metropolitan cities and transfer it to their wives. For example, in the state the rate of population growth has been above national average. It is 25.07 against the national average of 17.64. Bihar is the fastest growing state in terms of the population growth. In contrast to the national average of population growth, Bihar is growing 25.07%. The child mortality rate in Bihar is 42, whereas the national average is 40, and maternal mortality rate is 219 and national average is 178, which means that, this data clearly indicates that there is a population growth in Bihar. People are extensively, the women is highly reproductive and giving birth to lot of children, but the child mortality rate is high and the maternal mortality, which gives a clear indication that there is a lack of medical facilities, lack of awareness for health for both mother and child. Women's literacy is at a dismissal of 53.33 as against national average of 65.46. We all know that Bihar is much behind as compared to the national data in terms of women literacy, and the crude birth rate is 27.6 as against the national average of 21.4. This has increased the pressure on ASHA worker, especially in the state of Bihar, because that becomes the greater responsibility of ASHA workers to look after women and child, newly born child, because there is a clear indication that the pre and postnatal services are not accurate. Either the women is not approaching or the government is not providing the schemes which are actually made for the women. Then the next point, the next issue which is important in Bihar state is that ASHA workers in the state number although there are more than 71,350 ASHA workers, and most of them come from families with low income and are from socially unprivileged communities, because these ASHA workers are not highly educated. They get a formal education of up to class 8, and most of them have joined National Rural Health Mission program to earn some extra money, since their families were not in a position to educate them further. So they are given, these ASHA workers are given some preliminary training so that they can look after women and the newly born child. Several women are divorcee or separated, widows or unmarried girls. These kind of women are not given preferences. So ASHA workers are basically women who are leading a normal life, but they are not educated, they are not much educated, but they are trained by the people. The overworked ASHA workers in Bihar has to do multitasking. It is for this reason that in Bihar only 26% of pregnant women are able to avail the 3 standard checkups needed. Because since there are lots of number of ASHA workers in Bihar, but the case is that only 26% of pregnant women are able to avail the 3 standard checkups needed, because these ASHA workers are not able to pay full attention to their services. Only about 50% of deliveries are institutional deliveries, and the immunization rate also stands at 40 to 45% in the Hindi speaking belt. That is the North India, where only 40 to 45% of women are going for immunization of their children. There is not a very good perception. People do not perceive ASHA worker as a as a positive or as a strong source of support for women. Now, what is the attitude of people towards ASHA worker? An underdeveloped semi-feudal society considers the ASHA worker some kind of low caste women who is given the status of chamarin, that is a Dalit. Now, the people who are introduced in the social system for the welfare of women, for the welfare of looking after women who are afraid of going to the medical practitioners, and they are like moderators between the medical practitioners and the women in need, these people, the semi-feudal society, the patriarchal mindset of the society named them chamarin or a Dalit, who has been not given that recognition which she deserved. She is often humiliated by doctors and permanent nursing staff. Lack of infrastructural facilities like pakka roads, local transport, etc. are still major issues in rural Bihar, because there are lot of infrastructural problems in Bihar, and due to which these ASHA workers cannot perform their duties also appropriately. Like for example, if a woman is in labor pain and the woman has to take to the hospital, and due to lack of transport or due to poor road and non-availability of local transport, ASHA worker is not able to bring patient to the hospital, then it becomes the total mistake or total crime by the ASHA worker that you are inefficient and you are not able to do your duties at best. The ASHA workers are supposed to be given a meager support for each institution delivery, but according to first hand information, they only get 300 rupees and rest is taken by the medical staff, hospital staffs in the various health clinics. So, even if she brings up women for the institutional delivery to deliver a child in the hospital, she gets only 300 rupees. It is also strange that rupees 150 per child as honorarium is given to an ASHA worker only under the condition that she achieves total 100% immunization in the village. So, for a big effort, whatever honorarium an ASHA worker should get, that honorarium depends on number of other duties which has been given to the ASHA worker. That is why the NRHM program, they introduced ASHA workers, however, it was not a big success, and especially in the state of Bihar. In case it drops to 50%, she is paid nothing. So, if a child is not immunized and the 50% immunization is done, then the ASHA worker will not get any honorarium for that particular purpose. Whereas, for a pulse polio program, she is given hardly rupees 75 for a whole day of work. So, whole day when she will give pulse polio drops to number of children, then she will get 75 rupees for that particular job. For an individual completing family planning, rupees 150 is given, and several ASHA workers have complained of sexual harassment by the male employees at the hospitals and government hospitals, as well as male relatives of expectant mothers. So, not only they are not even getting proper payment for anything, and moreover they are also experiencing sexual harassment experiences even in the families where they are going for the welfare of women. For example, the husband of the woman who is going to deliver a child, that husband is sexually harassing the ASHA worker, or in the hospitals the doctors and other male staff, they harass ASHA workers for some or the other reasons. Now, what are the various discriminations which are faced by ASHA workers? This is very important to understand, because these are the things which finally decide that why ASHA workers was not a big success in NRHM program. Although they are appointed on contract basis and acquire skills during their term of work, they are not being made accountable to the employer, that is NRHM. So, whatever they were doing, their credits were not counted by the employer, that is NRHM. The people who were in between, they reported their own credits. For example, the doctors and other hospital staff, they used to claim their credit for everything, not the ASHA workers. And many ASHA workers feel that they must be freed from the culture of corrupt health bureaucracy, so that they can work in an environment which is autonomous and free from corruption. So, basically in Bihar, the ASHA workers are facing a corrupted environment where they are daily they are facing the challenges of how to face and how to rectify these corrupting situations. Some important events and facts, along with there are some important facts and events in the state of Bihar which needs to be addressed. Along with the Bihar State Non-Gazetted Employees Federation and All India Central Council of Trade Unions, the All India Progressive Women's Education Association began organizing the ASHA workers in 2007. So, many organizations and associations came in forefront to deal with the needs of these ASHA workers and to handle the problems they are facing in different states. In more than a dozen districts, block level workshops were organized to understand their problems and discuss as well as resolve them through struggle. So, these organizations, they organized number of workshops and they tried to identify what are their problems, and those problems that can be resolved then and there, they were resolved through some struggle and interacting with the people at the local or district level. And then they also organized and brought a qualitative change in the consciousness of these workers. So, gradually as these organizations introduced and intervened for the benefit of ASHA workers, they gradually tried to improve the situation by intervening in the process of their work and their problems. The Indian Labour Organization is a big organization which in 45th session discussed the status of ASHAs and proposed the government that they should be treated as employees of the government and not voluntary workers. So, the first issue that was addressed by Indian ILO, that is Indian Labour Organization, was that first of all that these ASHA workers should not be considered as voluntary, they should be given an equal status of a government employee. This recommendation of the 50th ILO is yet to be accepted. This has not yet been accepted and still the work is going on. The Standing Labour Committee relented from including the issues of ASHA workers and other para workers in the 45th Indian Labour Conference in 2013, and the sad reality was that the unions let go of the opportunity without a vigorous discussion, forcing the ILC to adopt strong resolution. So, there was again this patriarchal mindset was operating and people were quite they were not comfortable in accepting a situation, a proposal that was totally talking about women. The unions was hard to get even the diluted proposal and try to get stronger resolution. So, there was not an acceptance for the fact that the situation of the ASHA workers should be improved. They were considered as just the helpers in the NRHM program and their situation should remain like that. The next issue that was addressed by ILO was that ASHA should also be entitled for 6 months maternity leave. All these things are at present they all are in proposals. The ASHA should also be entitled for 6 months maternity leave and other maternity benefits. Next, there should be a separate restroom with privacy and adequate security for ASHA workers in all medical establishments to which they take women for delivery and treatment at all odd hours, because the work of the ASHA worker was not confined to the time and place. It was such a kind of work that any women can have labor pain at any point of time, and then they should have such kind of comfortable situation for delivering a child in privacy, and the situation should be provided to the ASHA workers. There should be then there was also a proposal for the transportation facilities, that if an ASHA workers want some kind of ambulance or some kind of conveyance for taking a pregnant woman who is going to deliver a child, then the women should be brought to the hospital safely in a proper vehicle. So, finally, seeing the situation of Bihar, it can be concluded that all these things are proposed by Indian Labour Organization. However, still the condition of ASHA worker is in a debatable state and it needs lots of improvement. Thank you so much.